From the food we eat, the air we breathe, the land we dwell, to the health of our body and mind and the well-being of all things in the universe. Unlock the science with Chula Radio Plus.
They are one of the most vital organs inside our body. They provide support and protection for our soft tissues and act together with muscle to make our body's movement possible. If they are broken, we will have serious problems living our daily life. They are bones. Hello, I'm Lawan Jirasuladet. The latest statistics have shown that broken bones from osteoporosis and injuries are more common than many people have thought. Osteoporosis, or the condition that the bone strength is deteriorated, causing bones to break or be injured easier, is the second most problematic health threat in the world, falling only behind heart disease, according to World Health Organization, cited in a fact sheet of Thailand's Ministry of Public Health. It is a silent threat to our health that normally does not show any symptom until it is too late. Department of Medical Services of the Ministry has revealed that up to 90% of Thai citizens are at risk of osteoporosis at a certain period of time in their lives. This is a very concerning figure because broken bones can significantly harden the patient's lives, especially when the broken ones are at the important parts, such as hip. 80% of these patients cannot perform their daily life activities, 40% cannot walk, and 20% will die within 1 year. Data of Department of Medical Services also shows that more than 30,000 elderlies in Thailand are suffering from broken bones every year. It is estimated that 1 in 3 of women aged over 60 are sickened with osteoporosis, while 1 in 5 of men under the same age range also suffer the same. Not only physical inability, osteoporosis patients will also face with very expensive treatment costs of up to 300,000 Thai baht, or about $10,000 per case per year. The rise of overweight people also contribute to higher cases of bone injuries as well, because higher weight puts higher stress on bone. Medical advisors from Ministry of Public Health also warn that body fat can disrupt calcium absorption and the repair mechanisms of the bones. Luckily, Thai patients now have option to replace their broken bones with artificial ones made from titanium, the result of a medical breakthrough by a researcher team of Faculty of Engineering, Chulalongkorn University. By applying metal 3D printing technology, it is now possible to manufacture and deliver custom-made titanium prostheses at an affordable price in just 7 days. The price of each titanium prosthesis is around 30,000 to 50,000 Thai baht, or around 1,000 to 1,500 US. This innovation was developed by Dr. Boonrat Lohwongwatana and his colleague at Faculty of Engineering, Chulalongkorn University. The university then licensed the technology to Meticuli, a private company set up by Dr. Boonrat and his teammates to make use of it for commercial purposes. Meticuli is said to be Thailand's first biomedical titanium bone implants manufacturing company. Under this technique, each of artificial titanium bone replacement is designed and made to suit individual patients, so it can perfectly replace their broken bones. This allows the patient to resume their normal life sooner than other treatment methods. Established in 2017, Meticuli has been working with surgeons across the country to design and manufacture metal 3D printed bone prostheses, in providing a local, customized, and affordable option to Thai patients and surgeons. So far, Meticuli can replicate up to 42 different joint and bone locations in our body. In order to prescribe these titanium bone implants, surgeons only have to upload a patient's CT scan to cloud server of the company and then use collaborative software to work with the company on implant designs. Once the design is finalized, it is sent to a manufacturing facility where the implant and corresponding surgical devices are 3D printed. Then the final items are sterilized, packaged, and delivered to the surgical theater. By far, biomedical titanium bone replacements of Medically have already saved more than 350 broken bones patients. The company is looking forward to make this technology even more affordable for greater numbers of patients. As Thailand is now facing with increasing aging populations, the needs for effective cures for broken bones will certainly be rising. Today we are glad to welcome Dr. Boonrat Lohwongwatana, an associate professor at Department of Metallurgical Engineering, Faculty of Engineering, Chulalongkorn University, and the person behind the development of Thailand's customized titanium bone implants technology, as our honored guest on this episode of Unlock the Science. Dr. Boonrat is also a co-founder of Medically. Up next, our reporter Prat Ruchitwanarom talks to him as we are taking a closer look on his biomedical titanium treatment.
How did you come up with the idea of developing biomedical titanium bone implants? And what is your initial inspiration behind this impressive medical treatment?
Well, I think it first started when my mother was admitted to the hospital about 6 years ago, and she was in the intensive care unit. And then I looked around, all the instruments, devices, raw materials, tissue paper even were all imported. So I had this feeling that there should be a way for an engineer to make a difference, to at least bring something that it's made in Thailand so that the cost is lowered and we could help support the medical professionals in a way. But then I looked around. My lab, my research background has been the precision manufacturing. That is to manufacture medical devices is possible, but it started from hard disk drives, electronics, automotive parts. And I just tried to extend the knowledge from precision manufacturing into medical world. And that's how I started. The first case was introduced to me by a doctor at King Mongkut Hospital, Dr. Tipachat. And at the time, he approached us and asked if we could make a titanium bone implant for one patient. And we looked at it. It was relatively simple in a way, using 3D printing technology. And I felt really good. My team and I felt really, really good that we could help someone. So I think that was a really life-changing moment, when I realized that at least this is something that I could follow my inspiration from the day that my mother passed away until today. This is, I guess, the inspiration.
Why did you choose titanium as material of choice for making artificial bones?
The gold standard for medical implants right now in Thailand are three main metals. First is stainless steel, second is cobalt chrome, and then the third is titanium. But titanium has always been known as the most expensive ones because of the better biocompatibility and also the inertness of the material to our body. And last but not least, the weight, the density of titanium is the lowest. Not really close to the bone yet, but it's one of the lowest density material that could be used as bone substitute.
What part of artificial bones that you have already been produced?
3D printing is a platform. So yes, to answer your question, anything that is bone related in our body, and there are 206 bones in our body that we could replicate, meaning take a CT scan and try to reproduce that bone part. But the difficulty of this is actually the biomechanics, how the movements are introduced into these moving parts. All the bones are moving parts. And also how the ligaments, the tendons are linked, are connected together. So we slowly introduce more and more products, more and more expertise in different areas. So right now we have 45 bone locations in the body that we could do. This is the sweat and tears and time spent with medical professionals in cadaveric study to make sure that the implants would fit with the cadavers before we actually introduce implants to the patient.
Do you have any plan to improve your biomedical titanium technology further?
Yes, I think the last 4 years have been trying to achieve the standards. When we talk about medical devices, the implants, it's not just the research ability, but we are now focusing more and more into new materials, new metals, soft materials. If we could print something like soft tissue, cartilage, we print ears for a patient who's missing an ear. We could print heart valve in the future, hopefully. I think it's endless possibility in the future. And titanium is just the beginning of our journey. And we hope to make a difference like that.
So the artificial organ, it also use titanium as the material?
I guess not really. 3D printing is more like a platform. Mm-hmm. So titanium is being 3D printed, but now we print biomedical materials, nanocellulose, alginate, all kinds of soft materials, plastics-based, bioplastics. So it's more or less a platform. And then once we print this, it's, if we have the capability to incorporate cells into the print job at the same time. So this is called bioprinting. We could incorporate cells right away, or we could print scaffold. Scaffold is like sponge. You print the sponge and then you introduce the cells so that the cells would grow into the sponge and become an organ.
As Thailand is now facing with the rising case of bone disease and bone injuries among the elderly and the overweight population, do you think this technology can help them?
Yes, I think one of the main fields that we worked on is to help osteoporosis patients. Normally, when we have elderly people in the house, we don't want them to fall down, because if they fall down, there is a big chance of fracturing somewhere, normally a pelvic bone or hip bone. And many elderly, after the fracture, they may not want to have a surgery, and then they are bedridden. The life expectancy after that is really shortened. There were some study that they would spend maybe on average of 1 year, staying alive after that. So I think it's really a traumatic event. With the aging population, with the osteoporosis, some elderly already have implants, like hip implants, total hip or total knee implants. And we have not really wanted to do the hip or knee implants, but everything that is surrounding it. When you fall down, you fracture a bone and the bone kind of collapse because of osteoporosis. Then we make that foundation for them before they have a knee replacement. So, and these cases are rather complex, and we are hoping that we could support medical doctors, particularly hip and knee surgeons, to perform the surgery easier and have the operation fast, the products that we make are drop-in solutions, so the surgical theater time is short.
We will take a short break now.
You are listening to Unlock the Science on Chula Radio Plus.
As we have previously discussed, the accomplishment of curing bone injuries with surgical implantation of artificial biomaterial. The key behind this success of bone treatment method is the selection of suitable biomaterial for artificial bones. In general, metallic biomaterials are used for body parts that need to bear weight. The materials must also have sufficient fatigue strength to endure the rigors of daily activities. With the introduction of biomedical titanium, it has brought the next step for surgical implantation of artificial biomaterial. According to Dr. Boonrat, titanium is by far the most preferable biomaterial for producing artificial bone implants compared to other commonly used materials, such as stainless steel and cobalt chrome. Titanium and its alloys have superior biocompatibility, corrosion resistance, and minimal side effect to the patient's health. Though stainless steel and cobalt chrome are relatively cheaper than titanium, they are reported to have negative impacts to patients' body. Dr. Boonrat said that stainless steel can release toxic substance into bloodstream, while cobalt chrome emits harmful ion that can result in brain-related issues, including dementia. Therefore, biomedical titanium provides wide ranges of opportunity for medical doctors to further improve the treatment of osteoporosis and patients with bone injuries. We are going to talk to another expert about applying biomedical titanium technology on osteoporosis and bone injury treatment. Dr. Charoenlap is an orthopedic surgeon at Chulalongkorn Hospital and a lecturer at Faculty of Medicine, Chulalongkorn University.
What are the main benefits of curing bone disease with biomedical titanium bone implant?
I will explain about bone damage first and how we can use 3D printing titanium bone implant for reconstruction surgery. Bone damage that we mentioned is a large bone defect caused by either bone tumor or unrepairable traumatic injury. In general, we have two choices of material for replacing this bone gap. First one is bone graft from cadaveric bone donor, and the other choice is a conventional prosthesis. However, in some locations such as finger, wrist, elbow, face, and scalp, it may be difficult or impossible to find size and shape of donated bone and prosthesis that fit with the patient bone defect. These cases are suitable for using titanium bone implant. Titanium bone implant is different from a typical orthopedic prosthesis. It's made using 3D printing technique, and data is from the CT scan of patient, while typical modular implant use manufacturing process for mass production. So, size and shape of titanium bone implant is matched with individual patient. This is the main benefit of the 3D print titanium bone implant. It made reconstruction surgery possible for patients with bone defect in location that ordinary prosthesis is unavailable.
How can it improve health and quality of life of the patients?
Actually, two main purposes of 3D printed titanium bone implant in terms of quality of life is function and cosmetic. I will tell you about my patient. The first one is 60 years old man who has aggressive bone tumor of wrist bone. At his first surgery, we have already used his leg bone to replace wrist bone, but it failed after 8 months. There was no conventional orthopedic prosthesis for wrist bone. We probably need to do a wrist fusion, which results in that patient cannot move his wrist anymore. So we decided to use a 3D print titanium bone prosthesis. Now he is happy with it. What I am so surprised is that he can twist doorknob, which is quite impressive for reconstruction. The similar patient, she is chef, and she told me that she can chop pork with a very firm sensation on her wrist using 3D printed titanium bone reconstruction. One case that we did titanium finger bone reconstruction, she was 50 years old woman who has a tumor on her middle finger. An X-ray showed that her bone it just looked like it disappeared because the tumor has already replaced all her finger bone. We suggest her to do amputation because the finger may be very short and interfere with hand function. However, she chose to keep her finger. So we use a titanium bone replacement on her finger, and now she's quite happy with it. But loss of her extension function of the finger. But she can keep her finger as her wrist with nearly the same length.
Are there any opportunity or challenge in the future for this technology?
I think for now it might be difficult for 3D print technique to produce prostheses for weight-bearing joint replacement such as osteoarthritis of hip and knee because it requires a special technique for smoothing the bearing surface. But in case of small joints such as osteoarthritis of finger from rheumatoid arthritis or osteoarthritis itself, 3D print prosthesis can be an option. Medically team and us has some design that we are doing on research scale right now, and we wish that it could be a market available in next 2 or 3 years. If we have the machine that can produce the prosthesis that lasts enough for using in the large joint, and we could be collaborate with some engineer in our university to smoothen the surface. Probably 3D printing that can be used in the large joint can be possible.
How should we take care of ourselves to prevent us from bone disease or bone injuries?
I would recommend exercise and having proper dose of both calcium and vitamin D for any old age population to decrease the rate of the bone loss. However, osteoporosis is a silent disease, especially menopausal women. Patients usually did not know that they have this condition. The risk of having osteoporosis is fracture of the spine and hip bone, which may lead to decreased quality of life, limit daily life function, and in the worst case is death, especially in 30% of hip fracture. So my recommendation is if you are high risk of having osteoporosis, such as a menopausal woman, or you have many underlying diseases, you need to check bone mass density at hospital. If you have osteoporosis, there are many medications that can prevent you from the fracture. So there is no need to worry about treatment. And ask your doctor to do a bone mass density measurement, or we can call this a BMD.
If we take good care of ourselves by eating well and have regular exercise, do we still have the chance to suffer from bone disease?
I think this requires a very good question because you think that you behave good enough and you don't need to face any danger or anything that, but I told you it's just a silent disease. You don't know that you will have this condition. You have to do a measurement. You have to do a bone density measurement to confirm that you don't have this condition. It's just like you ask if you already behave like this and you have no cancer, it's not very logical. So my recommendation is still that if you are high risk of having osteoporosis, you should do a bone mass density measurement.
Since the ancient time, bone injuries were often considered to be gravely serious or even fatal health threat in many cases. Because of the complexity to heal broken bones, many patients are left with lifelong difficulties to perform daily life tasks. Fortunately, with the significant medical science breakthrough, now we have successfully come up with the effective biomedical titanium for making artificial bones implants. By applying 3D printing technology, patients can get customized titanium bone implants that fit to their body, which allow them to restore their normal life. A startup company of Thailand, Medically has picked up this research success and commercialize it to pursue the mission of making this technology accessible to the wider public. Yet, this is not the end of the road. As the rate of aging population and obese people has constantly increased, Thailand is facing imminent challenges of rising osteoporosis cases. Though we can put our mind at ease that Thai researchers are now working against the clock to improve orthopedic treatment and get us ready for these challenges. But in the end, the best bones are our own natural ones. Therefore, we need to maintain healthy lifestyles by consuming high calcium food and keep our body in shape. Unlock the Science would like to thank you, Associate Professor Boonrat Lohwongwatana and Dr. Charoenlap, both from Chulalongkorn University, for their insights on biomedical titanium bone implant technology. I hope you enjoy our program. You can listen to Unlock the Science on Chula Radio Plus at FM 101.5 every Saturday from 1 p.m. to 1:30 p.m. You can also listen and follow us on our website, curadio.chula.ac.th, and our Facebook page. Our program is also available as podcasts. See you again next Saturday. Have a nice day.
Unlock the Science is edited and produced by Sinfa Tunsarawut with Lawan Jirasuradet as the program host and co-producer.